Hello, I'm Nadia Mantovani from St. George's University of London, and in this presentation I'm going to report some of the findings of a recently completed systematic review and the meta-analysis. Although the salience of IPV as a risk factor for mental health outcomes has been researched, none of the existing reviews have disentangled how different types of IPV impact on different mental health outcomes in women. None have explored the differential impacts of IPV on different female populations, such as the perinatal, the health-seeking, or community-based. Therefore, these were the aims of our systematic review and meta-analysis. The systematic review was supported by the involvement of a survival panel. To be included, the studies had to be quantitative, published from 2012 to 2020, assessing IPV exposure and associated mental health outcomes in civilian women aged 16 and over, using validated measures for both IPV and mental health. The language was restricted to English publication. Statistical data was extracted from prevalence, odd ratio, and 95 confidence interval. 201 study met all the eligibility criteria with a total sample of over 301,000 participants, of which over 250,000 were women. Of the 201 study included, 134 recruited participants from clinical settings with a clinical diagnosis, which could be either pregnant women or women in their first year postnatal, or women seeking help from primary care or drug and alcohol or mental health services. The remaining 67 studies recruited from the community, such as nationally or regionally representative surveys, colleges, online sources. Predominantly, studies were surveys, and the studies conducted across 46 countries, mostly were located in high-income countries. A variety of mental health outcomes were measured across the studies, of which depression was the most measured by 144 studies. This slide illustrates that the lifetime experience of any IPV was the most prevalent, with 37.3% of women reporting lifetime experience of any IPV, whilst 24.2% of women reported any IPV in the past year. Of the IPV subtype, psychological violence was the most prevalent, with 32.8% of women reporting lifetime psychological violence and 27% reporting past year psychological violence. The lowest prevalence was reported for sexual IPV for both the past year and lifetime. The odd ratio between the experience of IPV in the past year and depression was very strong, indicating that the association between some of the IPV domain and depression is very serious. More specifically, women reporting past year experience of physical violence were at the highest risk of developing depression, with a pooled odd ratio of 3:14, whilst women with past experience of psychological violence were 254 times more likely to develop depression, and women with past year experience of sexual IPV were twice more likely to develop depression. Population subgroups explain significant heterogeneity for both physical and psychological IPV, and the pooled odd ratio for help-seeking women was the highest across all violence subtypes, although this was based only on one study. These slides report on the association between past year experience of type of IPV and different mental health outcomes. And it shows that for anxiety, the highest increased odds was associated with the experience of sexual violence at 234. Whereas the odd ratio for the association between the different type of IPV and PTSD ranged from 215 for sexual IPV and 266 for psychological violence. All these studies were perinatal women. And although these results are not significant, there is a clear trend towards a positive association between type of IPV and developing PTSD. Looking up psychological distress, the association between the different type of IPV and psychological distress did not vary greatly, ranging from an odd ratio of 203 for psychological violence to an odd ratio of 253 for sexual violence. Women with experience of physical IPV were at the highest risk of suicidal ideation, with a pool odd ratio of 4.85. The slides reports on the association between lifetime experience of IPV and mental health, and it illustrates that the lifetime experience of any IPV had the highest increased odd ratio, indicating that women were over 5 times more likely to have suicidal thoughts, but with high heterogeneity between studies. This heterogeneity was inflated by one study. Also, I want to draw attention here to the psychological distress. Women with lifetime experience of any IPV are over 3 times more likely to develop psychological distress than those without the experience of IPV, with low heterogeneity among study. To summarize, the global burden of lifetime and past year IPV is still alarmingly high, with the psychological IPV in the past year and lifetime being the most prevalent form of violence, while sexual violence in the past year and lifetime is the least prevalent among women. We found consistent evidence that IPV exposure significantly impact on the mental health of women by increasing the risk of adverse outcomes such as depression, suicidal thoughts, anxiety, PTSD, and psychological distress. Here are the collaborators in the study, which is currently in press. And thank you very much for listening.